If you're diabetic, missing just one key vitamin could be sabotaging your blood sugar control, and most people don't even know it until complications arise. Imagine if a simple daily supplement could protect you from nerve damage, reduce inflammation, and even help your insulin work more efficiently. Are you ready to discover the vitamins that could change your diabetes journey? Don't miss out on this life-altering information. Before we jump in, make sure to hit that like button, leave a comment with your thoughts, and subscribe so you never miss a crucial health tip. And for even more expert advice, check out my ebook, Eat to Beat Diabetes, in the description. Your ultimate guide to food lists, recipes, and meal plans. Link in description. The first vitamin is vitamin D. Why it's critical for diabetics. Insulin regulation. Vitamin D plays a key role in the function of pancreatic beta cells, which produce insulin. Studies have shown that diabetics with low vitamin D levels often experience poor blood sugar control. Inflammation reduction. Chronic inflammation is a major contributor to diabetes complications. Vitamin D helps modulate the immune response and reduce inflammatory markers. Bone and heart health. Diabetics are at increased risk for osteoporosis and cardiovascular diseases, both areas where vitamin D offers protection. How to boost your vitamin D. Sunlight exposure. Aim for about 20 minutes of direct sunlight on your skin daily, but remember that factors like skin tone and geographical location play a role. Dietary sources. Incorporate fatty fish like salmon and mackerel, fortified dairy products, and egg yolks into your meals. Supplementation. Most experts recommend a daily intake of around 2,000 IU, but consult your doctor for personalized advice. Did you know even those who spend plenty of time outdoors can still be deficient? This is why monitoring your levels is so important. Want more details on how to naturally manage your diabetes? Don't forget to check out Eat to Beat Diabetes for a step-by-step guide to nutritional success. Link in the description. The second vitamin, magnesium. The insulin helper. Why magnesium matters. Enhances insulin sensitivity. Magnesium is essential for the proper function of insulin receptors. A deficiency can lead to increased insulin resistance, a common challenge for diabetics. Studies suggest that higher magnesium intake correlates with improved post-meal blood sugar levels and overall glycemic control. Neuromuscular support. Adequate magnesium helps prevent muscle cramps and nerve issues, which are frequent complaints among diabetics. Getting your magnesium fix. Food sources. Load up on green leafy vegetables like spinach, nuts, especially almonds, seeds. Pumpkin seeds are a great choice, and avocados. Supplement options. Magnesium citrate and glycinate are known for their high absorption rates. A daily dosage between 300 to 400 milligrams is typically beneficial. Lifestyle tip. Incorporate a magnesium-rich smoothie into your morning routine for an easy nutritional boost. The reality is, more than 75% of diabetics are not getting enough magnesium, which could be undermining their insulin function.
For a comprehensive meal plan that ensures you're getting all the right nutrients, grab a copy of Eat to Beat Diabetes. It's packed with expert-approved recipes that make healthy eating simple. Link in description. The third vitamin, alpha-lipoic acid, ALA, the nerve protector. The critical role of ALA. Neuroprotection. Diabetic neuropathy is a major complication that can lead to painful nerve damage. ALA is a potent antioxidant that helps protect nerves from oxidative stress. Improved insulin sensitivity. ALA not only helps protect nerves, but also enhances the way your cells respond to insulin, thereby supporting better blood sugar regulation. Reduced oxidative stress. By neutralizing free radicals, ALA reduces the oxidative stress that contributes to long-term diabetes complications, such as kidney disease and retinopathy. Incorporating ALA into your routine. Dietary sources. Foods like spinach, broccoli, tomatoes, and even organ meats contain natural ALA, although in relatively small amounts. Supplementation guidelines. Research typically supports taking between 300 to 600 milligrams of ALA daily. Many healthcare providers recommend taking it before meals for optimal benefits. Early intervention. If you're experiencing early signs of nerve issues, such as tingling or numbness in your extremities, it might be time to consider ALA supplementation. Imagine being proactive about nerve damage before it starts. This simple step could save you years of discomfort and potential complications. Take control of your diabetic health by learning more in Eat to Beat Diabetes. This ebook offers in-depth guidance on nutrient timing and meal planning to maximize the benefits of supplements like ALA. Link in the description, and remember, investing in your health today could save you countless medical expenses tomorrow. Now that you've learned about the top 3 vitamins every diabetic should take, it's time to ask yourself, are you giving your body the support it needs? Vitamin D helps regulate insulin and fights inflammation. Magnesium ensures your insulin works properly and supports overall metabolic health. Alpha-lipoic acid, ALA, shields your nerves and enhances insulin sensitivity. Drop a comment below and share which vitamin surprised you the most. For even more expert-backed advice, don't miss out on my ebook, Eat to Beat Diabetes. Inside, you'll find everything from detailed food lists and recipes to complete meal plans, all designed to help you manage your diabetes naturally. Remember to like, subscribe, and click the notification bell for more actionable health tips. Invest in your health today. Grab your copy of Eat to Beat Diabetes and take the first step towards a better, healthier life.